To chair this session, I would like to invite a chairperson, Dr. Kuldeep Gupta, renowned plastic surgeon, Dr. J.K. Singh, Professor, Department of Pediatric Surgery, Eminent Medical College, Prayagraj, Dr. K.S. Jaiswal, renowned plastic surgery, Prayagraj. Chairperson to introduce our speaker, Dr. Sunil Gaba.
I am extremely thankful to Dr. Gaba for having accepted our invitation, and even more so for waiting patiently since morning to deliver the talk in the last. Thank you, Gaba. Thank you so much.
Good evening. It is my pleasure to introduce Dr. Sunil Gaba. Dr. Gaba is a faculty in Department of Plastic Surgery, PGI Chandigarh. He has many papers, both in national and international journals, and his area of interest is brachial plexus injury, microvascular surgery, and rhinoplasty. And let me tell you one thing, he is the one who led the team who replanted the hand of a policeman during COVID time who lost his right hand in Punjab. So he is the one who replanted the hand in 7 hours, and he will tell us what does these 3 words mean to us, to a plastic surgeon: reform, restore, and repair. Dr. Gaba, please.
When all the surgeons finishes their work, our work starts. This is the most common problem we plastic surgeons face. So when we talk about the plastic surgery, it's a problem solving specialty. And most of people think that we are only taking care of burns or the cosmetic surgery, but it's not like that. We do head to toe, whatever area you ask us. I think most of the plastic surgeons are doing it. And today I'll be trying to show the spectrum of the plastic surgery, and in terms of repair, restore, and the reform, and what are the newer, latest things we are doing. And I hope that I try to show most of the in the case forms, so you should not get bored. So if we see the history, Sushruta was the father of the plastic surgery. He did in 800 BC, and it was from India only. Then the plastic surgery was not the norm. Most of the some small reconstructions were going on until the World War. During the World War, we have a lot of amputation, lot of defect. So then the plastic surgeries come in the picture. So this is the picture. If you see, this was the very old picture somewhere in 800 BC. Sushruta used the forehead to reconstruct the nose. And then in the modern era, Tagliacoji used the arm. So these are the procedures which have very, very historical importance. But now, where we stand. So over the period, plastic surgery has come a long way from its early day of rudimentary procedures to the sophisticated field of medicine that encompasses a wide range of technique. So where we do repairing, restoring, and reforming. So repairing means any injury happen, if plastic surgeon repairs, they repair under magnification, they repair it differently, they try to hide the scars. Scars will be there, but they try to hide the scars. Restoring means if someone is doing cancer surgeries, they are taking out some part, so the plastic surgeon job is to reconstruct that area, or somebody has lost some part due to the accidents and all that. So then again plastic surgeon's responsibility comes. And reforming is the aesthetic surgery. Somebody has something deformed, so we reform it. So these are the 3 things which we have to understand. It's like that: repairing, reforming, and restoring and reforming. So what is in the future? Future is all about precision. How precisely we operate someone, what good results we give, it's all about precision. So we do have a lot of technology available these days which are helping us to achieve near normal or the perfect results. So I will be showing that also. So repairing means if there is any traumatic injury, any laceration, we usually repair. So all the surgeons repairs. What does plastic surgeon do differently? They usually do it with the magnification, fine sutures, and keep it in the Langer's line so scar should not be visible. We repair nerves, we repair vessels, we repair tendons. we do reimplantation, as Dr. Jaiswal said, we take care of burn management and as well as the congenital. So if you see the spectrum, plastic surgery is everywhere when it comes to the surgery. So if you see this patient, someone has operated, they have put the sutures, but there was a mismatch of the eyebrow. And patient was depressed after that. Then she came to me. So we have to re-elevate everything and just we have to do the positioning. So this small surgery makes a lot of difference in the patient confidence. So that's the thing. Here the role of plastic surgery comes. And if you see this patient, one thresher injury, whole scalp has came out. Patient was from Mohali, so she came in time. We reimplanted it, and you can see her. After 3 months, she was having absolutely near normal face. So these are the miracles which a plastic surgeon can do. And thanks to the sophisticated techniques and the microscope and the microsurgery techniques which we have these days. So this is the famous case which I did during the COVID time when a Patiala policeman was, his hand was amputated by a Nihang, and he came into the time because when we started this case, we didn't know that it was such a high profile case. But by the time we finished it, we were everywhere. So then, if you can see, we followed up this case for 6 months, and now patient is almost 70 to 80% recovered with this hand and using his hand. So this is a totally teamwork where my team was very efficient. They helped me out, and post-op period also we did the good physiotherapy. So then in December, we operated in April. In December, he came driving his car to me, and then it was a very nice feeling. And then he started wearing turban also with using this hand. So what else we want? If we do it in timely, we can do miracles. So this is a policeman. He usually comes, and it's really always a grateful feeling for a surgeon when patients are very happy. So like these are the congenital anomalies. We usually do it. Courtesy to Dr. Jaiswal, he gave me these pictures. I usually don't operate these cases. And you can see the results. Such a remarkable result. It really totally changed the patient life. This is another case where if you see, this is having a problem in the voice. There was a palate, bileopharyngal insufficiency. Patient was operated nicely. So you can see he was having very good voice. So what are the future in repairing now? So already we are using magnification. So what new will come? There are now scope of exoscopes, and where the reimplantation of the hand failed, then the hand transplant. So what is an exoscope? Exoscope is a new device. If you see, this is a camera, magnified camera. So you can operate, take to even the deep areas where microscope cannot go, and you can have the 3D screens in front of you, and with the good hand and eye coordination, you can operate anywhere. Even these days, these type of specs also available, 3D specs. So you can do this. So fortunately, we are going to have in near future in our institute this one. So this really helps to dig in the different deep areas. Like when we are operating palate also, sometimes it is difficult to see inside. So such a small camera, we can focus anywhere in the body, and we can do that. And the hand transplant, fortunately, in last 7-8 years in India, a lot of hand transplant has been going on. But yes, there is few issues with this because we have to give lifelong immunosuppression. So that's, people are working on that, and I visited John Hopkins regarding the same. People are really working on this single drug immunosuppression. Once it is discovered, definitely it has a great scope in the future. So now coming to the restore. Restore means some part has lost. So we have to restore it either from the same part of the body or some allograft also. So usually we restore using some other part of the body to that particular defect. So like skin graft, everybody knows about a skin graft, and most of the people think that plastic surgery only does the skin grafting. No, I will show the cases what we do actually. Skin graft, tissue expansion, microsurgery, breast reconstruction after mastectomy, and these all things really improve the quality of life of the patient. So if you see the skin graft, earlier we used to do this skin grafting meshing with the hand. Now we do have a high quality of measures, and we can expand it like anything. Skin graft and flap, this is a very common surgery. I hope everybody knows about it. And then if you see, these are the expansion. Tissue expansion is a really very interesting thing, which we usually do in the benign cases or in the burn cases. Like you have seen this tumor, and we have expanded before excising it, and after excising, that expanded skin has been used to cover that defect. So patient have normal hair bearing scalp. So it's interesting, and if you excise it, put a graft, patient won't have hair. So we restore the form and function both in this patient. If you see the same girl, young girl, having some benign lesion on the face, we put the expander in the neck. This is the expander. It works on the principle like in the female get pregnancy and their skin get extra. So the concept came from there. So we put a balloon in the neck, in this case, and expanded it over the 3 months, taken out, and you can see the well hidden nice scar. So these are the things which we can do. So these are the cases, the post-burn injury where we use expander and patient got married after the surgery. But still we have no answer to a few things. This was the total facial burn. I have done, I think, 10 expanders in this. Still the patient is like this. So I'm not satisfied. What should we do? So now what future has for this? There will be face transplant. So that is the choice for this. So, but face transplant, again, it's a very challenging procedure. It's fairly new and very complex. Since the first face transplant in 2005, since then, 40 people has been undergone, but there's a high rejection rate, and some patient has the identity crisis. So it is still a lot of research is going on. So this is the future ahead for these type of patients. So now the next thing is the restoring the malignant cases, head and neck reconstruction. We all know most of the oncosurgeons daily doing these things, and plastic surgeons are helping them out. So you can see the tumor. We take fibula along with its vessel. We do the microvascular reconstruction. So near normal results we are getting. So again, so you can see there are a lot of things which we are doing. But what is the future here? Even in the currently, now it is not future. 3D printing and virtual reality, this is the reality now, and it is almost a standard procedure these days. So here I'll show you that how we actually do this 3D printing and other planning things. So like after COVID, we do have a lot of mucormycosis cases where a lot of maxillary defects are coming to us. So when we, if you see, so how we plan it actually. So if you see, there is a defect of the maxilla. So we mirror this side to the other side, and then we know what is the exactly defect, and then we 3D print this model, and we do the mock surgery in the lab and before doing that, usually we do the virtual surgery also, and then we reconstruct it with the fibula. So if you see, first we see the defect, and then in the same time we 3D print the fibula also, but in this we are doing first virtual surgery. CT scan of the fibula is converted into DICOM images, then to the STR files, and with the help of the engineer, we are doing this surgery on the computer first, and you can see how we plan it. So by doing this, we can have precision in our surgery, how much depth of the fibula is required, how much length, how much segments of the fibula is required. So we plan it beforehand. Once we plan it, then we print that defect part, print the fibula, and in the lab, before the surgery, we do the mock surgery first. So we come to know before the surgery, we need this much of the segment, this much of the vessel length, this much of the soft tissue. So these are the technology really helping us a lot, and we are getting very good results. So once we finish this, we know that we need 3 segments of this shape with this angle, and then we do the mock surgery. So this is the way how we plan it, and this we 3D print the model and the fibula as well, and then we do the plan. So you see here, this is the model. We planned it. We need 3 studs. We extrapolated it on table. You can see this IOR, this is the annulus, this is the zygomatic arch, and this is the vessel. This is the vessel going down. And this patient was reconstructed with the free fibula. These surgeries usually take 8 to 10 hours, and you can see this was the pre-op, this was the reconstructed one. Then we superimpose the opposite side on that, and you can see the green area. It denotes that it matches very nicely. this is the superimposition we do, so we can know that what kind of results we are getting. And you can see the patient. This was the pre-op and this is the post-op with the dental implant also inside. So this kind of precision we can have with this type of surgery. So this is the norm now actually. Most of the people doing it, and I have done almost 10 cases in the last 2 years. Because of the COVID, we do get a lot of maxillary cases these days. These are the mandible cases. We do the same principle with the mandible also, and we are frequently doing this. So these are the pre-op, this is the post-op. You can see she was having big adenodenoma. This is the post-op. There was a plate inside. We did fibula, so you can see this. And these are the superimposed pictures. So green area denotes the matching of the reconstructed part. So these things I have already published. Mandible I have already published, and I am going to publish about the maxilla soon. So now the next, what is the future now? 3D printing is common. Now the next thing is the 3D bioprinting. So what is this? 3D bioprinting is where we are using the stem cells and introducing those cells of the same, like we have to take some skin cells and making a bio ink, and using the printer we are injecting those bio ink into the scaffold. So we can have the skin or ear like these type of the structures, and we can use it. So this is still under process, but I think future has about all these bioprinters now. So next line generation is this. So now coming to the vascular malformation, I hope most of the physician even also see the vascular malformation in this. So what new in this? It comes like it is a venous malformation. Usually we operate and excise it, you can see the good results. But when it comes to the arteriovenous malformation, it's always a pain because there is a high chances of bleeding. And so now regularly we are doing pre-operative embolization to these, and then we excise it. Pre-operative embolization with the glue or gel and the coils, whatever the form your intervention radiologist is okay with it, we do it, and within 48 hours we operate. So you can see this is a high flow AVM. There are a lot of this is a feeder vessel, and you can see that there is a leash of vessel. And on table within 48 hours we operated, so you can see how blood vessels looks like, and it makes your job very easier, and you get fantastic results. There is no recurrence. We are able to excise it completely. You can see we have excised completely. This is the feeder vessel, and this has been also taken. So this is the results. So if we do these things, really the technology, the new latest designs, everything is helping us out, and we have to aware of all this to get the good results. This is a like cranioplasty. This is a patient, some neurosurgeon operated, and he lost his half of the calaveria. Then one colleague has just done the local flap over it. Then patient was having slurring of speech because of the trephination syndrome. So I did the cranioplasty, used 3 ribs to make the cranioplasty, and patient was happy with this. So what is the future in these things? So now there's a future of this cranioplasty, or in all these things there's a navigation surgery. Frankly, I'm speaking, fortunately we are also having this navigation system at our institute. So how does it work? In navigation system, it is a very interesting thing. Usually we put implant and put the screws, but we don't know where our screws are going, where implant is going. So with this navigation, we do the pre-op CT, feed to the system, and same we do the mirroring of that area, and we know these are the points where implant should get fixed. And if you see, these are the mirroring of the skull has been done, and on the right side we want this type of shape. So we have planned it. So this is the system we have. This is a console where we feed the CT scan pre-operatively, and in real time we know where our implant is going. And these are the cameras, and on the patient head we put adapter. So you can see there is an adapter which is connected with the Bluetooth with the camera, and it takes signals from the camera, and we can with these probes we can see where we are in the orbit or anywhere. So this will tell us on the real time that now we are here, and in the CT scan we can see that this is the point where we are. So it really helps us to achieve the precision. So this is a case of orbital floor fracture where I think I have done 10 cases of this. So now you can see on table we can see where is the probe. So it is, we put probe here and then we can see on the screen that our probe is going there. So this is the technology where we are using it. So now brachial plexus, I think last time when I came to Allahabad I presented brachial plexus injuries. We're usually doing it. So brachial plexus, most of the people think that we don't get good results. No, it is a myth now. Most of the brachial plexus patients, we usually get very good results if we intervene in the time. So what is new in brachial plexus? So these are the results I think most of the plastic surgeons getting easily these days. So what is the future of the brachial plexus? Because when we do the brachial plexus surgery, we work in the deep cavity. So sometimes it is difficult to access. So the role of robotic surgery. So one of my friend, he has already started brachial plexus surgery using robots in AIMS. So we do also have the robot. So this is the next new thing is coming. The robotic surgeries for the nerve repairs and the brachial plexus. So now coming to the most interesting part, the reform, which is very good for the layman. Always laymen think that cosmetic surgery is the only domain of the plastic surgeon. So it is not like that. Although reform, when we talk about the cosmetic surgery, it is mostly, this is a procedure like rhinoplasty, liposuction, breast augmentation. These are the procedures most commonly done. And the new thing is the fat grafting, which is really fantastic, and I hope most of the plastic surgeons really love it. So I'm just showing this case because this case done by one of dermatologist, and then he had the necrosis. He did the hair transplant and he went to some local surgeon. They said they will put a graft, which will be a disaster. So with our plastic surgery techniques, we were able to cover it and giving the scar in the hidden area. So you can see how we operate these things. So these plastic surgery means planning, just sheer planning, nothing else. So rhinoplasty. So she is a model in a Chandigarh. She was not happy with her nose, and I operated her nose, and she is extremely happy. So this really gives the confidence to the patient. So these are the lot of rhinoplasties which we can see. So now you see this is a 17-year-old girl with the unequal breast. So we have reduced it, try to preserve the nipple, and fortunately we get the good result. This is another unmarried girl. She was having large breast, having neck pain. So we did the breast reconstruction. So these are the domain of the plastic surgery. And liposuction, I think most of the people knows about it, liposuction. But liposuction should be done, it is not a weight reduction surgery, it is body reforming surgery. We have to understand that. It is not a weight reduction surgery. So when we do the liposuction, like this is a resident area, she was having a lot of fat globules here, so we did the liposuction and she had a fantastic result. So like that body contouring after bariatric surgery, you can see there is a hanging loose skin. So I did the belt lipectomy. This is circumferential abdominoplasty. So if you see, we can have a fantastic results if we do with the planning and in the right time. So what I am talking about in the reforming is the fat grafting has a really very good results if we do it nicely. You can see this is the girl. In India, it's a trend. All the patients come when they want to get married. Before that, she was living with this face for 25 years, but she never came. Suddenly, now she wants to get married. She came to us. I did the fat grafting recently in September 22, and then the second session, and 2 days back I did the third session also. Because with the what is the problem with the fat graft? It usually resolves. When we do the fat grafting first time, it resolves more than 50%. When do second time, it's 30%. So we have to do multiple settings. So now the future is how to prevent the resorption of fat. So there are lot of things, lot of research is going on about the stem cell and the regenerative therapies. I myself did one study using ADSCSC, and we published it. So these are the really promising things which we are doing. And another thing is for the facial aesthetic surgeries, we are having this latest technique Vectra, where we can analyze the facial volumes and we can assess that how much volume is required in particular that area. So this is a fat graft. The article which I published in 2019, I think, So that I used in painful amputation stumps, and we studied it for 18 months. We saw when we put ADSCC, it really reduces the paralysis option. So this is an interesting finding. It was sort of a pilot study because we did only 10 cases, so we didn't find any significant thing. But yes, it's an interesting finding. So as Dr. Mohit was asking me that you should talk something about AI. So now AI is just, it may be future. I go on through few articles, but it's in infancy stage in terms of plastic surgery, because it is purely on the database, what is data there in the system, and they analyze that data, and this gives the information. But yes, it is a good tool to have it, so it always helpful the surgeon and the physician. So it has got three things: planning and scheduling, machine learning, and the natural language processing. Machine learning is really very good, where they take it from the available data and matches it. If it matches, they give the diagnosis. So machine learning is very good for the radiologist. So in plastic surgery, yes, it is good tool for teaching the residents and good tool to have a better understanding of the diagnosis. So now when we talk about these all future procedures and everything, so there is a ethical and philosophical discussion is always there. So as our understanding of body image, mental health, and individual autonomy deepens, the boundary of what constitutes a valid reason for undergoing plastic surgery may shift. Society will grapple with questions related to the body positivity, culture, influence, and the responsibility of the medical profession in meeting and demand of diverse and evolving patient population. So to conclude my talk, plastic surgery with its multifaceted roles in repair, restoration, and reformation has evolved significantly over the years. It has gone from rudimentary procedures to cutting-edge technique that can transform lives. The future of the plastic surgery holds immense promise, with technology and ethical consideration poised to shape a field in new and exciting ways. Thank you. Thank you very much.
Thank you very much, Dr. Gaba, for a nice presentation and finishing in time. And I think you have covered all the aspects of plastic surgery, and you have justified your topic also with your presentation. Thank you so much.
Thank you.
Now I request our President AMA, Dr. Subodh Jain, President-elect Dr. Kamal Singh, Dr. Ashutosh, Secretary, to felicitate our speaker. Dr. Sunil Gaba, please give him a good round of applause. I also request to felicitate our chairperson also. Dr. Kuldeep Gupta. Dr. J.K. Singh. Thank you.